The UK's COVID-19 inquiry, launched in 2022, has a weighty task to examine the nation's pandemic response and learn lessons for the future. The first report, released in June 2023, paints a sobering picture of a country ill-prepared for a pandemic of this scale. The inquiry, chaired by Baroness Hallett, heard from experts, politicians and bereaved families, exposing critical weaknesses in the UK's pandemic planning and response. This essay will delve into the key findings of the report, focusing on the state of the healthcare system, the adequacy of personal protective equipment stockpiles, and the impact of austerity on pandemic preparedness. The inquiry's findings highlight the state of the NHS before the pandemic. Years of underfunding and rising demand left the NHS vulnerable. Chronic staff shortages and limited bed capacity were major issues. This strain meant the NHS struggled during the first COVID-19 wave. Pandemic planning focused on influenza, not COVID-19. This left the UK unprepared for a novel virus like COVID-19. One of the most shocking revelations from the inquiry was the inadequacy of the UK's personal protective equipment stockpile. The report revealed that the government's pandemic stockpile was insufficient to meet the demands of a pandemic on the scale of COVID-19. Critical items like masks, gowns and gloves were in short supply, leaving frontline healthcare workers dangerously exposed. Furthermore, the inquiry found that the government's procurement processes for PPE were slow and often chaotic. This led to delays in getting essential equipment to those who needed it most, putting healthcare workers and patients at risk. The lack of a clear and robust plan for procuring and distributing PPE in a timely manner was a significant failing in the UK's pandemic response. Section 4. Ignoring the warnings, expert testimony and political accountability. The inquiry heard from a range of experts who had raised concerns about the UK's pandemic preparedness in the years leading up to COVID-19. These warnings, often ignored or downplayed, highlighted the need for greater investment in public health infrastructure, more robust pandemic planning, and a greater focus on potential threats beyond influenza. Politicians, including former Prime Ministers David Cameron and Theresa May, and former Health Secretaries Jeremy Hunt and Matt Hancock, were also called to give evidence. Their testimonies revealed a lack of urgency in addressing the UK's pandemic preparedness in the years preceding COVID-19. The inquiry also scrutinised the government's decision-making during the early stages of the pandemic, including the timing of lockdowns and the implementation of testing and tracing systems. Section 5. Austerities shadow a decade of cuts and their consequences. A recurring theme in the inquiry's findings is the impact of austerity on the UK's pandemic preparedness. Following the 2008 financial crisis, the UK government implemented a series of austerity measures that led to significant cuts in public spending, including funding for the NHS and public health services. The inquiry heard evidence suggesting that these cuts had a detrimental effect on the UK's ability to respond effectively to the pandemic. The inquiry also examined the impact of Brexit on pandemic planning. The UK's exit from the European Union led to uncertainty and disruption, potentially diverting resources and attention away from pandemic preparedness. The loss of access to EU-wide systems for disease surveillance and early warning systems may have also hampered the UK's ability to respond effectively to the pandemic. Lessons learned, charting a path to pandemic preparedness. The UK's COVID-19 inquiry exposed critical weaknesses in pandemic preparedness. It highlights the need for resilient healthcare systems and adequate stockpiles. The inquiry is ongoing, with more reports expected. The true test is whether the government will act to strengthen resilience. The COVID-19 pandemic has been defining, and learning from mistakes is crucial. The inquiry offers a chance to understand the crisis and improve future preparedness. Its findings are vital for the UK and globally, as pandemics remain a constant threat.